Today's lecture is about urinary system infection. A urinary system infection is an inflammatory reaction caused by the invasion of pathogenic microorganisms into the urinary system. It is a type of non-specific infection caused by common pathogenic bacteria and one of the most common diseases in urology. The urinary system infection is commonly referred to urinary tract infections clinically. It is divided into upper urinary tract infection and lower urinary tract infection by the infected site. The upper urinary tract infection often refers to the infection that involves kidney, renal, pelvis, and the urethra sites. And the lower infection refers to the involves bladder and urethra. First of all, the pathogenic bacteria causing urinary system infection are mainly divided into two major categories: non-specific and specific pathogenic bacteria. Of the urinary system infection, 70% are caused by non-specific pathogenic bacteria, mostly Escherichia coli, accounting for about 50%. Other pathogenic bacteria include Proteus, Klebsiella, Salmonella, and Pseudomonas aeruginosa, as well as Staphylococcus, Streptococcus, and Enterococcus faecilis. The mycoplasma, chlamydia, fungus, protozoan, and virus infection are also causes of urinary system infection. With the extensive use of antibiotics, infections caused by various pathogenic bacteria and mixed infection have also increased. The specific pathogenic bacteria mainly include Mycobacterium tuberculosis and Gonococcus. How is the urinary tract infected? When the defense mechanism of the urinary tract infection is destroyed and the pathogenic bacterium are increased to a certain amount or produce certain virulence, infection can be caused. There are some bacteria at the external urethral orifice or distal urethra or normal body called normal flora. The normal flora plays an important role in inhibiting and balancing the pathogenic bacteria so that the body has a certain defense function against infection. Other defense mechanisms are normally urine environmental, normal urination, and the anti-adhesion effect of erythroleum. In addition, the amount and virulence of bacteria are also important in the formation of infection. According to the latest study, the susceptibility of urinary tract infection is also related to blood group antigens, genotype characteristics, endocrine, and other factors. There are three main factors that include infection. One is decreased immune function and anti-infection ability. The second is obstruction in the urinary system. As the urinary system is a piping system, any lesion on the system will lead to an obstruction, resulting in obstructed urine drainage and making the system prone to infection. The third is medical factor. Infection may be caused during the cathetering, urethral catheterization, cystoscopy, urethra dilation, and endoscopy. The urinary system infections develop by four major routes, and ascending and hematogenous routes are most common for that caused by non-specific bacteria. The ascending route, where pathogens gain access to the bladder via external urethral orifice and ascend to upper urinary tract, is the most common route of urinary tract infection, often in female patients, while the hematogenous infections are often believed to secondary to infected lesions on other parts of the body, such as purulent folliculitis, amygdalitis, and tympanitis. Pathogenic bacteria enter the organs of the urogenital system via blood circulation system, resulting in urinary tract infection. Additionally, lymphatic route and direct invasion route are also included, where the pathogens from lesions in adjacent organs of the urinary system can spread via the lymphatic system and enter the urogenital organs to cause infection. Infections from adjacent organs of the urogenital system, such as vermiform, appendix, abscess, and purulent pelvis inflammation, can also spread directly or bring the pathogen into urogenital system to cause infection. Frequent urination, urgency of urination, urodynia, and dysuria are typical clinical manifestations of urinary system infection, especially in acute stage, thus making the infection easy to diagnose. The infection is mostly diagnosed by test of urine specimen, which is usually collected by three methods. The first is to take the midstream urine, the second is to perform urethral catheterization, and the third one is paracentic suprapubic cystectomy to draw a diagnosis conclusion by urine examination. The second way is microscopic examination on urine specimen. There are no white blood cells and red blood cells in normal urine, and when the urinary tract infections occurs, the white and red blood cells in urine may increase, and more than 3 white blood cells found under a microscope may suggest the possibility of urinary tract infection. Bacteria culture is also a way of diagnosis and localization test in addition to uroscopy. Immunological examination and urodynamic study are also served as auxiliary methods of diagnosis the urinary tract infection. The purpose of treatment of urinary tract infection lies in the elimination of pathogenic bacteria, alleviation of symptoms, and prevention of renal function damage and spread of infection. The sensitive broad-spectrum antibiotics are selected according to the results of urine bacteria culture and drug sensitivity test. The drugs are used corresponding to the symptoms of frequent urination, urgency of urination, urodynia, and dysuria. The lesions that cause urinary tract infection, such as obstruction of the urinary tract and stones, are removed. During the treatment period, the patient should be provided with the nutritional support, rest well, drink more water, and urinate at least 2,000 ml every day.